Linda and I have been swimming a lot. All good. Linda and I have been swimming a lot the last 2 weeks that we've been down here, and we've seen some of the fish that I'm going to show you here. Fortunately, we didn't get stung or touch any of them. So we'll go through some of those. Okay, so these are the Dirty Dozen. We'll talk about these in no particular order. The lionfish is one that we've seen a fair amount of here. They're relatively small. I don't think they're much of a danger unless you accidentally step on them or something like that. A lot of the times, some of these are dangerous if they have a spike or if you get stung by them, and some if you eat them, like the pufferfish. You can get a toxin if you touch them, but the big problem with that is if you choose to eat that fish. We'll also talk about some of the other fish-borne illnesses that you can get that hopefully are avoidable. The jellyfish that you see on the left of the screen, those can be pretty deadly. Fortunately, not allowed in the Caribbean. A lot of these are in the Indo-Pacific and Australia. But we'll talk a little bit about those, and then we'll answer that age-old question, should you pee on a jellyfish sting? Okay, so this is the stonefish. Stonefish. They're very dangerous because they have a spine on their back, and on the bottom of the seafloor, they look like a rock. So if you're out in the water and you're not wearing any kind of protective footwear and you step on one of these, you're likely to have a problem. It's fairly venomous. It's one of the most venomous fish around. Stings can be fatal. One of the good things to do if you're walking on the seafloor, let's say you're out on a sandbar or something, you should shuffle your feet in the sand. You want to, because most of the time these things don't view you as prey. You startle them, you accidentally step on them, and that's how you inoculate yourself with the venom. Like everything else, it's about how much venom is injected, how susceptible you are to it, location of the sting. Sometimes if you survive a stonefish sting, you can have symptoms, neurologic symptoms for weeks. You can have toxic skin breakdown similar to that brown recluse, necrotic skin. Also punctures to the chest if for some reason, you jump in the water and you hit one of these into the chest. A lot of time you die not necessarily because of the venom, but because of a puncture of a serious structure. We'll talk a little bit about Steve Irwin and how he died from a stingray. So the barb is somewhat retracted in these dorsal fins. And when you pull back the sheath of the barb, you can see that it's a pretty deadly looking spear there. There's a venom sac that's halfway down or 3/4 of the way down the spine of this. And if you were to step on that, it causes the sac to reflexively release the venom. Unlike some of the bees where it's a one and done when they sting you, this one can live to sting you multiple times. And you can see that there are multiple spines on the back here. So there's a good chance that if you were inadvertently stepped on this in the water, that you could get multiple puncture wounds and multiple envenomations. So again, footwear, either sandals or some kind of shoes if you choose to be walking on the bottom, and shuffle your feet to alert these, and usually they'll swim away before you get there. Some pictures of affected limbs. Obviously, the lower extremity is going to be prone to this because of the nature of the sting. You can see a lot of swelling. Remember what we were talking about with cellulitis or infections? You draw a little ink line, or you draw a little line on it to see if it's progressing or getting better with time. The hand and the feet, they have a lot of compartments in them, so they're not particularly tolerant of swelling. If you look at your own palm, the skin is very adherent. If you have a puncture wound in the hand, there's a fairly good chance that it's not going to swell much on the palmar side. It's going to swell on the dorsal side here. So that's why if you have an injury to the hand, usually you get swelling on the top of the hand, not so much on the palm. but there are a lot of compartments in the hand and the foot. Remember we talked the other day about compartment syndrome. If you have swelling of the muscle in a compartment, you need to sometimes do a fasciotomy or open that compartment up. Same thing with the hand. If you have a significant infection or swelling, those need to be opened up, because otherwise the pressure in that compartment is going to exceed the arterial perfusion pressure, and you'll have ischemia to a limb or low blood flow to the limb. So again, the stonefish pretty well disguised on the ocean bottom. So soaking in hot water, warm water, I think maybe 114 degrees Fahrenheit, will, and for about a half hour, 45 minutes, will inactivate the venom. Now we reflexively think, oh, I should probably put ice on something that's inflamed. In this particular case, heat is better. Remember, ice is kind of the poor man's pain reliever. It's going to cause vasoconstriction. It's going to reduce some of that inflammatory response. Heat generally increases blood flow to an area. So if you have a traumatic injury, a sprained ankle, or you have a fracture or a wrist injury from a fall, generally it's going to be ice in the beginning. So this is contrary to that. This you're going to treat with heat. This is also, heat is going to be effective in some of the jellyfish envenomations that we're going to see later on. So heat, and it's not just 5 minutes of warm water running under a faucet. You need to leave it on for about 30 minutes, 30 to 45 minutes. Obviously, you clean these things because you're at risk for infection. So just regular soap and water. If you don't have sterile water, just regular hose water, any kind of just running water. You want to kind of reduce the bacterial load. You're never really going to be able to get deep into a puncture just with superficial cleansing on the surface. If you see somebody in a treatment area, we have these kind of, you can take a saline bottle, to put punctures in the top, and you can use it as a little squirt bottle, and you can really irrigate it well. They also have these pressure irrigating tools. You'll see this for people that have deep punctures or things that need to be irrigated. It's got like a little suction cup that goes over the skin, and it's kind of like a pneumatic gun that you're really vigorously irrigating it with. If a little irrigation is good, more is probably better. Topical antibiotic ointments, it says here. Again, what I told you before was with punctures, I don't really like to put a Vaseline ointment over those because it occludes any spontaneous drainage, and you want there to be some drainage. It's probably not going to be real harmful, but I wouldn't put a big glob of Vaseline or petroleum jelly or an antibiotic gel and just let it sit there. I guess coating the area would be fine, but I wouldn't occlude the puncture site. There is an anti-venom to stonefish, but generally it's reserved for people that are having systemic signs or symptoms or not responding to general first aid measures. Again, just like we said with snake bites the other day, you may be bit by a snake, but you might not get much venom. In this particular one, if they're having minimal symptoms, you may not give them anti-venom. And why do you want to reserve the anti-venom for severe symptoms? What can you get with any of these Envenomation anti-venoms? You can get a serum sickness. And remember, sometimes the cure is worse than the harm. Tetanus, we always talked about. And remember, tetanus toxoid, every 5 to 10 years for dirty wounds, once you've had your primary immunization, 5 to 10 years. We give a diphtheria with tetanus, because if you're outdated on your tetanus immunization, you're probably outdated on diphtheria. So that's a DT. And because pertussis, whooping cough, is back on the rise, now we add pertussis. If you have friends or that have a small child, or you're visiting somebody with an infant that has not been vaccinated, you really need to be up to date on your pertussis vaccination. These antibiotics here, you see cephalexin, amoxicillin, all penicillin-based, cephalosporin or penicillin-based, because still, even though these are dirty, you're still going to get a lot of the skin contaminants, staph and strep and those kind of things, gram-positive stuff. If you were wearing a old sneaker and you were walking and you stepped on a stonefish or on a rusty nail under the surface, or you had a puncture wound that went through your shoe, the sole of your sneaker, what are we at risk for? Not strongyloides. Tetanus, yes, but what type of bacterial infection? Remember, 9 out of 10 times a puncture wound is going to be probably a staph infection. But there's something very specific when you step on, like through a construction boot or a sneaker, Pseudomonas infection. Pseudomonas, because that sneaker, warm, moist, Pseudomonas loves that. So you will treat people if they have a puncture wound through a shoe. You'll treat them for staph coverage, but if they're not responding, there's a good chance it's a Pseudomonas infection, and then you need to bring out the big guns. For somebody that's getting worse, you may need to give them parenteral, meaning intravenous antibiotics, and you may have to debride or cut away some of the non-viable tissue, but those are for serious wound infections, or if somebody has a necrotizing skin infection, or they're becoming septic as a secondary result of the infection. Okay, so that was the stonefish. Kind of a relative of the stonefish is the lionfish. These are the ones, they're normally found in the Indo-Pacific, but people would bring these in as pets or for their aquariums, and then they're predatory fish, so they feed on other fish in the tank. And if they get too big, the people were letting these loose into the natural environment. These have now taken over the reefs in southeast USA, in the Keys. There's actually a bounty on these in the Keys. If you catch these, you can spear these and you can bring them in and you get some type of reward. They're trying to really get rid of these from some of the reef because they're very aggressive towards your indigenous fish species on the reef. This is the red lionfish. The ones that I've seen here, not this big, and they're a black and white for the most part. And to me, they don't really particularly look that dangerous. They're just kind of drifting around in the water, hanging out by the rocks, and there's other fish that are going right by them, and they don't seem to be too bothered by them. So some of the times the envenomation from this is if you were to catch a lionfish and you went to clean it, that you puncture your hand while doing the cleaning, and that's how you get the venom. Certainly, again, if you stepped on one or you somehow, I don't know, antagonize one and they chose to be too close to you, you could get stuck with that. But generally, these are the spines that are on the back, and if you step on them or somehow come in contact when you grab them or clean them and you don't know, you can inoculate yourself. So they're outbreeding, outliving, and outeating most of the competing native fish in the Atlantic, the Gulf of Mexico, and the Caribbean Sea. I think if you go to Keeping It Real, this is on the menu sometime. Not all the time, but they sometimes will have lionfish there. And again, when you're cleaning this and preparing it is sometimes where you'll get envenomation. It is on the list of Ciguatera, and we'll talk about Ciguatera infections or Ciguatera toxicity that you can get, and they include this one because it is a predatory fish that concentrate in their body toxins from smaller fish. They can sometimes have a toxin load that you can get very sick from. So this is on the list, as are grouper, which I like, snapper, which I like, and barracuda that I've eaten, but they're all on the potential list. They seem to be regional, so you may be able to eat grouper from one part of the Caribbean, not have a problem, and then there's other areas where they're associated with Ciguatera toxicity. Ciguatera is kind of, well, I think we're going to talk about it, but it's really hard to detect. There's not a unusual flavor in the fish. It's not due to improper preparation. It's just in the flesh of the fish. Again, similar to that stonefish, you can see the spines on the back and on the side that are going to have the toxin. So if you were trying to clean this fish and you grabbed it or you held it improperly, you can stick yourself with this. Or if you caught one and were trying to get the hook off of this, you could see that you could easily get your hands damaged. It's a painful sting, probably like a wasp or a bee sting at first, And then it progresses with swelling, warmth, erythema. Erythema means redness. And again, sometimes after you've had a sting from an insect or a fish, it's going to get red and warm. That's not, if it happens really quickly, that's not due to infection. That's due to inflammatory response. So when somebody gets stung by a bee or they get stung here and they come in an hour later and the area is all red and swollen, that's not an infection. Now, not to say they won't necessarily get an infection, but that quick response is due to histamines into the area, this inflammatory response, increased blood flow. Systemic symptoms such as diaphoresis or sweating, muscle weakness, paresthesias, a neuropathy, infection, tachycardia, abdominal pain, and syncope. So the spectrum really can be wide depending on how much inoculation you have. It's rare to die, but again, as we always say, the extremes of age, the young, the old, a good hefty dose of envenomation, you can get very, very sick. You always want to make sure that there's no retained piece of the spine. So if these people come into your clinic or come in to be seen and they have what looks like an infection the day after, you should probably take an x-ray of that because these spines can snap off. And if you don't get that out, you're going to get a foreign body reaction and a secondary infection. Soap and water, hot water for 10 to 20 minutes, probably longer is even better to invalidate the toxin. Over-the-counter, OTC, analgesics, tetanus always, x-ray if you think there might be a spine in there. Antibiotics, pretty much the same of what we saw, right? The penicillin-based ones. And somebody with progressive signs of infection, you're going to need to give them intravenous antibiotics. Let's talk about Ciguatera for a second. There's two that we're going to talk about. This is one of them. It's probably one of the more frequently reported seafood-related illnesses. Consumption of reef fish that have accumulated this Ciguatoxin. The bigger the fish, the longer they've lived, the more smaller fish they've eaten, the more likely they are to concentrate the Ciguatoxin. It's from an algae species that colonize the coral beds. The toxin is eating by all the fish that are on there. Then the grouper or the barracuda eat that fish, and they concentrate that toxin in their flesh. So some of the ones, the predatory fish, barracuda on your top left, they pretty much leave you alone if you're swimming near barracuda. They're attracted to shiny type of things like a little bait fish. So if you're swimming, you're snorkeling, you're scuba diving, you don't want shiny, dangly necklaces or things that the barracuda could mistake for a bait fish, because then they're going to strike at it. So I have a St. Christopher medal I wear. I always have it tucked inside the top of my wetsuit. So you would definitely not want to have a lot of shiny stuff for barracuda. This one on the right is a red snapper, very tasty. This one they do serve it, keeping it real. That's again a predatory fish, and they can accumulate the toxin. This bottom left one, what's that big bad boy? That's a grouper. There's something called a Goliath grouper, which weighs about 300 pounds. I don't know if you've ever seen those in an aquarium or what have you, but they're huge. They got a huge mouth, and the way they attack their prey is they open their mouth quickly and it sucks in the water. So if a prey is, I don't know, 12, 18 inches away, they open their mouth, there's this influx of water and it sucks in the smaller fish. And this bottom right one, does anybody know what that one is? That's a hogfish. Hogfish also are predatory fish, and they can concentrate the toxin. Signs and symptoms pretty much shortly after you eat this, probably within a matter of hours. Nausea, vomiting, diarrhea, so it hits your gastrointestinal tract pretty quick. Paresthesias, that numbness and tingling in the perioral area, hands and feet. Kind of sounds like hyperventilation. I'm not sure why the hands, feet, and the oral area seem to be more susceptible to these symptoms, but those are the classic areas that we see. And then patient starts hyperventilating because of fear, they're sick, they're not feeling well. That's going to exacerbate that feeling. Arthralgia, that's joint pain, arthralgia. Myalgia, muscle pain. It's pretty weird. cold feels warm, warm feels cold. Kind of a unique thing, but it mucks around with your temperature receptors. It can start within 60 minutes and can last days to months, depending on how much. This is probably what a friend of ours had. He was in his mid 40s. He was a great athlete, good shape. He worked for IBM, and he was traveling, and he went, I think he was in, I want to say Maryland or something like that. He went out to eat dinner. He consumed fish that night. Later on, he started having symptoms. Next day, he got very, very sick, and he had the sequelae, a lot of neurologic symptoms. It caused him to have disability, and they believe that it was secondary to Ciguatera toxin. So he must have gotten a heavy, heavy dose. And then remember, everybody's body's going to react to some of these toxins a little bit differently. I don't know that you can necessarily develop a resistance to it by repeated exposure, but certainly everybody's going to have a little bit of a different response to it. These are some of the other symptoms that you may see with it, but these are the main symptoms. So it's not detected by smell, unlike one of the other ones we're going to talk about. It's not removed by proper freezing or cooking of the fish. It's sporadic. It occurs in areas, so it's not necessarily. Remember, it was the algae that grows on the coral that's eaten by the coral fish that's eaten by the predatory fish. So it seems to be in certain regions, and there's outbreaks of it. I'm not telling people, I'm not telling you not to eat certain fish, but if it's in the area, there'll usually be some notification, and they'll try and avoid those fish for a period of time. The larger the fish, the more accumulated toxin. So in an area where they're having problems with it, they will sometimes post signs like this. These are the fish you should probably stay away from. And I've probably eaten about 4 or 5 of these without a problem. I hope I didn't just jinx myself. Treatment is supportive, no antidote. Activated charcoal. What does activated charcoal do? It's like a slurry drink that you drink. It's like a black slushy. Activated charcoal goes into the GI tract, goes into your stomach. It binds toxins. We sometimes use this in overdoses if it's in the first 60 to 120 minutes. We stay away from Ipecac. Ipecac is something that induces vomiting. We don't really do that a lot because sometimes overdoses, the people are a little obtunded. You induce vomiting, they could aspirate, which can make it worse. Charcoal we still use. Also, the thing about charcoal is not only does it take the toxin out in the intestinal tract, but it also impacts as toxins or things are absorbed, they go through first pass in the liver, and then they go back in the bile into the GI tract. So it works not only on the initial toxin, but on the stuff that comes in after it's cleared through the liver. Antihistamine, so symptomatic relief. Zofran for nausea and vomiting. Dehydration with fluids. What type do we give? Normal saline. If hypotensive, not responding to fluids, you can give vasopressors, norepinephrine, dopamine. That's going to elevate your blood pressure. You can have more severity if you have significant exposure. I think the friend that we were talking about, I think he was on a ventilator for a bit of time. So he must have had a very, very severe reaction. Type 1 diabetic, so he had complications associated with that. Amitriptyline is something that we give for neuropathy sometimes. The name for that is also Elavil is the brand name. Amitriptyline is the generic name for that. We give that for neuropathy sometimes. Symptomatic bradycardia, you can treat that with atropine. Remember, so when you do your ACLS training or you're exposed to ACLS, atropine is one of the first line drugs that we give for a bradycardia. Bradycardia, usually with heart rate less than 50, less than 40, is usually going to cause a drop in blood pressure. Unless you're a finely tuned athlete who has a resting heart rate in the 40s, these marathon runners, these cyclists, these athletes will sometimes have baseline heart rates of around 45 and their blood pressure is fine. If I had a toxicity from one of this and had bradycardia, I would probably not tolerate a heart rate of 45. Steroids, vitamin supplements may be given. They don't really necessarily, they may aid in recovery, but they don't really do much to reduce the toxic effects. There were some studies done on mannitol. What is mannitol? It's basically a sugar. And we give that because it causes a diuresis. It causes the diuresis. Remember, your kidneys, they diurese in response to osmotic load. You give somebody mannitol, it's going to cause a diuresis. We'll give a dose of mannitol and somebody has a head injury because of intracranial swelling. We want a quick diuresis. Mannitol works well for that. So there were some studies done with Ciguatera poisoning. Again, they don't exactly know how it worked. And there was some anecdotal evidence that there was some improvement, but it's not definitive. They talk about a mid approach can be to give mannitol in addition to normal saline to induce that diuresis. And again, you're given the normal saline not because they're necessarily hypotensive. You want to try and increase urinary blood flow, increase diuresis, and you want to keep that urine clearing any of the toxins. 20% mannitol is what we would use, or you can give it in a bolus. There were some cases where people who were really sick with bad toxicity had significant improvement after mannitol. So again, it's an option in that person who's very sick. The other one that we can get from eating fish is Scombroid. So Ciguatera is one, Scombroid is the other. Eating fish that's not properly refrigerated or preserved. So this is why if you're fishing, you really want to get that fish in the cooler or on ice right away. It's more common in fish that have high levels of histidine, and it's due to it's due to excessive histamine. But fish that have high levels of histidine convert the histidine to histamine. You eat that, and you get this very, very profound flushing as a histamine reaction. Probably going to obviously treat this with antihistamines. And there's a bacteria that grows in the fish when it's not properly refrigerated that cause this overgrowth of bacteria that converts the histidine to histamine. So it's basically a improperly prepared or refrigerated fish. In this particular one, they're going to come in and it might look like an allergic reaction. Look at this person's skin here, this diffuse allergic reaction. Those aren't really hives per se. It's just this significant flushing of the skin, face. If you have a big histamine release in your body, chances are you're going to have headache, not really feel real well, may cause some tachycardia and palpitations, some abdominal cramping. It can develop quickly in less than 60 minutes. So you may not have even left the fish restaurant when you start to have symptomatology. Supportive care, symptomatic treatment, antihistamines. Let's see if I might have something embedded in this one here.
Scombroid is a type of food toxin that occurs when particular fish are left out in the sun for an extended period of time. The particular type of fish that can cause Scombroid include dark tunas, albacore, bonito, sardines, mackerel, skipjack, mahi-mahi, and amberjack. One of the other terms for Scombroid poisoning is the mahi-mahi flush. The classic scenario for Scombroid poisoning involves several people coming into the emergency room from a restaurant where they'd all consumed fish for dinner. And the initial thought is that all these people have immediate fish allergies.
The unusual for having an allergic reaction, so that's kind of giveaway.
Exhibit more than one fish allergy simultaneously. Although that could happen, But when you see this particular pattern of 2 or 3 people coming in with erythematous red skin, diaphoresis, dizziness, pounding headache, tachycardia, nausea, vomiting, and diarrhea, you should have a high index of suspicion for Scombroid. Now, even if you do say, well, this could potentially be a food allergy to fish, the fortunate thing is that treatments are very similar. In many cases, Scombroid itself is self-limiting, but one of the treatments is Benadryl, which is what we also use for acute allergic reactions. The classic story, again, is going to be several people having been out for a fish dinner, perhaps at Captain Scombroid's seafood restaurant. They're going to report that the fish had a very peppery taste, and then within several minutes after consuming the fish, they're going to start to develop these particular symptoms.
Okay, so you get it, right? Let's see if I can do this without... Sorry about that. Okay. So those are the two, Ciguatera, Scombroid, peppery taste, Ciguatera, hard to detect, cluster of people from a restaurant that may be having symptomatology from poorly refrigerated fish. That's much more benign than what we see with the Ciguatera toxin. Fish that have high histidine levels, remember histidine converted to histamine, tuna, mackerel, mahi-mahi, some of the ones he just talked about. Salmon considered a low risk. It's a cold water fish, low risk. And again, it's different than a fish allergy. You're going to treat it about the same, antihistamines, fluids, supportive care. There have been some fatalities associated with it. These two women were in Indonesia, I believe, and they ate improperly refrigerated fish. Both of them, I think, had some kind of asthma history or what have you, so they were susceptible to some type of significant reaction. They probably weren't managed properly. One of them was on a migraine medication, which may be a vasoconstrictive agent, and mother, daughter both died after ingesting a histamine-containing fish. Okay, so those are a couple of the toxins. Now we'll talk about the pufferfish. This one we see on the reef here a fair amount. They usually like to they're not necessarily hanging out right in the reef. They're usually on the sandy bottoms or the grassy bottoms swimming around. They're generally going to leave you alone. And again, it's probably accidental exposure if you were to touch them. But again, the big problem with this one is if you were to eat the fish, this can be eaten, but it has to be properly prepared. We'll get into that in a second. They have a toxin called Tetrodotoxin. It's a neurotoxin, deadly to fish, so other fish will leave it alone. If a person should eat improperly prepared pufferfish, specifically the liver, where the toxin, the tetrodotoxin, is concentrated, you can get very sick with that. It's 1,200 times more potent gram for gram than cyanide. Range of symptoms: numbness, tingling, weakness, difficulty breathing, paralysis. Can be fatal if left untreated. You should not touch a pufferfish because the spines can also contain the tetrodotoxin, particularly if it's puffed out. It's a delicacy in Japan. It's called Fugu, F-U-G-U. Improper preparation will result in the food poisoning and can lead to death. You have to be trained specifically to prepare this. You don't want to go to a restaurant where it's the guy's first time in the kitchen and he's preparing the pufferfish. It's concentrated in the liver. It can lead to death if improperly prepared. About 50 people a year die of pufferfish poisoning in Japan every year. So that's called Fugu. If you see that on the menu at a Japanese restaurant, just realize you're taking your life in your hands if it's the chef's first time doing that. That's what the tetrodotoxin looks like. You'll see this tetrodotoxin, this neurotoxin, in some of the other envenomations we're going to talk about in a minute or two. Concentrates in the liver. We talked about that. I guess the toxin is produced by bacteria that are in the fish. They accumulate it. If you're a fish that is eating other fish that are concentrating their tetrodotoxin, they're going to be in the food chain. They're at risk for being carriers of this also. There's no antidote is available, so much of it is supportive care. ABC, you'll see this a lot in ACLS and basic life support. Airway, breathing, circulation. Airway, breathing, circulation. They've kind of changed that now a little bit. Now it's CABC. So if you come across somebody that's gone into collapse, they really want you to start chest compressions right away, because there actually is some passive movement of the air when you are of air in and out of the lungs when you're doing chest compressions. So they've kind of tweaked it a little bit. Now it's CABC, circulation, airway, breathing, circulation. So if you come across somebody that's just collapsed, good to start high quality CPR with chest compressions first. After a series of chest compressions, then you move on to ventilation. Intravenous fluids, IVF, pressors, norepinephrine, epinephrine, dopamine. You're going to treat arrhythmias. We talked about activated charcoal, same here. If it's a dermal exposure, you want to decontaminate the skin just with lots of flushing and irrigation of the skin. You can develop hypoglycemia, electrolyte abnormalities. Anybody with suspected toxicity from tetrodotoxin needs to be admitted to the ICU, at least observed for 6, 18, 24 hours. If somebody's doing well after 24 hours, chances are they didn't get a significant exposure. Neostigmine can be used in patients with respiratory failure. So Steve Irwin, the Stingray, remember he was killed by that? Let's just see if there's a little clip on that. Again, you're not the targeted prey of the Stingray. It's usually accidental.
Dangerous animals that he spent his life protecting. He was swimming with a stingray off Australia when its poison barb apparently pierced his heart. This is Irwin as he headed to his final expedition. Irwin stalked lions, stared down snakes, and wrestled crocodiles. Why would someone like Irwin always court danger? Well, researchers think they're beginning to understand. And ABC's David Muir takes a closer look.
He's probably sitting out there in a camouflage position.
His millions of fans likely thought Steve Irwin's final tangle would be with an angry crocodile or a venomous snake, not a stingray. But in the end, his fellow wildlife enthusiasts believe he simply got too close.
He came over the top of a stingray, and the stingray's barb went up and went into his chest and put a hole into his heart.
So what happened was when he was pierced by the barb, got him in just in the subxiphoid area. It punctured his pericardium, went into his ventricle. The ventricle then started to bleed excessively due to the puncture. The pericardium was intact enough to cause a tamponade around that. So he didn't necessarily exsanguinate from blood loss. He died of tamponade because as the pressure in the pericardial sac overcame the pressure within the heart to be able to expand, he basically had a collapsed heart, specifically right ventricle. So again, these are accidental type of stings. And again, like I was saying, if you're in the water, you don't want to be on top. If you're swimming, and these are usually on the bottom, you don't really want to be swimming right above that. You also don't want to be swimming above sea turtles, because sea turtles need to get up to the surface and breathe, and they can actually drown if you're preventing them from getting to the surface. So always be respectful of nature, give them their distance. Don't swim right on top of them, off to the side if you want to observe them. In another case, nearly hit a femoral artery, needed immediate surgery. That's just another thing. There's a program. It's called Stop the Bleed. It's sponsored by the American College of Surgeons, and it really talks about educating lay persons about hemostasis. In your travel kit, if you're ever going on any kind of expedition, you want to have a tourniquet with you. You can make a homemade tourniquet with a belt and different stuff, but there's commercial tourniquets that you want to have with you if you're going to be on a expedition or a trip and you're the medical person. I think I might have a picture of that. You guys are young enough that you may not remember Steve Irwin, but he was somebody that was well known, well respected, and he really just wanted to educate people, but he got too close and accidentally, again, this was not an intentional piercing. This is Stingray City in the Cayman Islands. I don't know if you've ever been to the Cayman Islands, but there's this bay where the stingrays congregate, and there's all these commercial tourist boats that go out there. And these ones must be more benign than some of the other stingrays, because they're bringing them, they're putting them up on people. The only downside is you get the oil from the stingray on your skin and you need to rinse it off. But generally they're pretty benign and they're not aggressive at all. This is Stingray City, and you can see the stingrays all over the place, the shadows on the ground. I guess you could accidentally get stung, but that's what the barb in the tail looks like. And you can see the barb has these little hooks on them that they can get embedded in the skin. They can break off. Anybody that has this stingray barb, you need to probably do an x-ray to make sure that there's not some retained barb in there. The puncture will cause pain, releases of venom. You can get some symptoms like the typical headache, nausea, vomiting, fainting, low blood pressure, seizures in severe cases. So the barb is protected by the end of the tail there. Again, common in the legs and the feet due to inadvertent exposure. Shuffle your feet. Again, this is one of the ones with hot water. You don't need to put ice on this, hot water. This person got pierced in the back. You can see the stingray's barb was cut off there, but it's embedded. These things, you can't just like yank them out. It's kind of like a fish hook with a barb on it. You can't just pull it out. Usually you need to kind of widen the incision site, and then surgically remove it. You can sometimes with a fish hook, if you ever get stuck, you can actually take a cap of a needle and you can work it under the skin, and you can or a small needle, and you can cover the barb and extract it. Sometimes you have to push it back out, push it through the skin and cut off the barb before you can remove it. So there's some tricks that you can do to get these out, but this would probably have to be surgically. You'd have to have the wound enlarged and remove that barb. Tetanus, always. You never want to be the guy or gal who forgets to give somebody a tetanus shot. It should just be a reflex. First aid, things we talked about, the typical kind of things. Hot water. Here's some x-rays of people that stepped on a barb. You can see the one in the foot there. It's going to be radio opaque. Radio opaque means it'll show up on a plain radiograph. Radiolucent means you won't see it. Even glass has a little bit of lead in it, so even glass will show up on an x-ray. You don't want to leave retained foreign bodies in there. Sometimes small pieces of glass, if you step on them, they're very hard to find, and they'll sometimes work their way to the surface with soaking. But I usually think it's kind of worth a little bit of a try trying to find that little fragment of a foreign body in there. If you can't find it after a couple of minutes of poking around in there, opening the wound up, sometimes I'll just leave it alone because you're doing more harm than good by probing around in there too much, and cover them with antibiotics. Here's what not to do. 47-year-old Danish man stung while walking in shallow waters, west coast of Africa, experienced pain, left ankle, limped to shore. A local sailor attempted to suck the venom out of with his mouth, similar to the things we said don't do with snake bites. He brought an unknown plant root, chewed it, put it on there. Pain lessened over the course of a few hours, and the compression was removed, and then it suddenly got worse. Fourth day, he developed a bad infections. Remember I said rigors equal bacteremia. You have shaking, chills, spike in fever. That's bacteremia till proven otherwise. So this guy had shivering bacteremia, shivering rigors. Wound had become infected. Started on oral antibiotics. Wound didn't get better. Red, swollen, necrotic. Ultimately switched to IV antibiotics. Had to be flown out for further treatment. Surgically cleansed. Samples of the tissue revealed a mixed infection with bacteria found from the human mouth. So sucking on the wound is not a good thing to do. These are some of the bacteria that are normal in the oral area of humans. You can see there's quite a bit. Strep being very predominant. Just as a sidebar note, this is what caused a clenched fist injury. If you're ever working in a clinic or in an ER and somebody comes in on a Saturday night or a Sunday morning after getting into a fight, they punch somebody in the mouth, they hit the person in the tooth, and they get what's called a clenched fist injury. So they have a laceration over the knuckle. Doesn't look that bad. A little laceration over that third MCP joint. Doesn't look that bad. Progresses to that top right one. And why is that? When you have a clenched fist like this, and you hit somebody with it, the front tooth of the other person or whatever pierces the skin and pierces that tendon or inoculates it. Then when I open my hand, what happens? That tendon slides back into the tendon sheath, and it basically inoculates or injects that bacteria into that sheet. So these kind of wounds, if you're ever working on a Saturday night or something, they really need to be flushed out. They really need to be flushed out. And you don't flush them out in the extended. You have that person go back to that position, and if you can expose the wound, you can usually see a little nick or something in the extensor tendon. So sometimes what you have to do is actually open the wound a little bit so that you can really irrigate it. But what you don't want to do is fail to irrigate it, close it up with a couple of stitches, and then before you know it, they're going to have a really nasty infection. This person ended up having surgical exploration in there. Oh, and by the way, the tooth was in there. So this is one of those ones where you probably want to get an x-ray also if there's significant swelling or a fragment of a tooth in there. But you can see what I'm talking about. As the finger is flexed, that tendon's gonna slide. Then when you unflex the finger and extend it, you're gonna basically slide that down. This is extensor and flexor tendon injuries of the hand. You really don't want to miss them. So as part of your physical exam, when anybody has an injury on the flexor or the extensor surface, you want to make sure that you do a good examination and put that finger through range of motion, and you test for strength. If you have people that have a partial extensor tendon laceration, they may be able to go through all of the motions as you're testing each joint individually, but if they have pain when they're doing it, that may mean a partial tendon laceration. So what we'll usually do is irrigate that, cover it, maybe splint it in a neutral position, and then send them to a hand surgeon for further evaluation. So washing out, I didn't even say the tetanus and the antibiotics, and minor lacerations, you don't normally need to give antibiotics to, but a clenched fist injury, high risk of infection, you want to give them antibiotics. Similar to punctures in the hand from a dog bite or a cat bite, those ones, high risk of infection, and you want to start them on antibiotics. Okay, back to the C envenomation. The cuttlefish, most cuttlefish are not toxic. This particular one is, it's called the flamboyant cuttlefish. Pretty looking fish, not particularly big. It's only about 3 inches long, 2 to 3 inches long. They're not a squid, even though they behave like one in the water. They produce a poisonous slime. They can bite you or they can bite their prey. And they contain that neurotoxin, that tetrodotoxin. They're venomous, meaning if they bite you, you can get sick. And if you were to eat this, you could get sick also. The landmark on this bold coloration usually means keep away. The muscle of the fish contains the toxin, tetrodotoxin. Again, a pretty cool looking animal. This is the blue-ringed octopus, another toxic sea creature. Made famous in what classic 1983 James Bond movie? Did you say it? Octopussy. The blue-ringed octopus. It's not particularly big, only a couple inches across. Sometimes they'll hide in a shell, so if you're on the sea floor and you want to pick up something that looks like a conch shell or something like that, just to see what it's in it, sometimes these will be hiding in there and you can get an exposure that way. Young boy, and there was a case of young boy who picked up a shell, had a cuttlefish in it. I think he put it in his pocket or something. He noted a bite, started to feel unwell. By the time the help got, he was stretchered off the beach, taken to a local hospital, treated for several hours, ultimately was released, and he did well, again, just with supportive care. It does have a tetrodotoxin. It's a relatively small animal, similar to the pufferfish toxin. It blocks the sodium channels, no known antidote. People can get if they get a big envenomation, they can get very, very sick. Usually after 24 hours, if there's no symptoms, they're going to do fine. There's actually a lot of research with this tetrodotoxin. They're thinking that it could be used for therapeutic reasons because of the way it affects the end plates, the sodium channels. Again, colorful sea creatures, they're basically telling you stay away. This is the Portuguese man of war. We'll get into a couple of jellyfish and then we'll wrap it up. This actually isn't not a jellyfish. This is what's called cyanophore. It's not one animal, many highly specialized animals working together. This top part floats on the surface generally. You might see that. It's pretty characteristic blue. These tentacles down below can stretch out 10, 20 feet from it. What typically, I was somewhere, I think I was near Key Biscayne, and it was very shallow, way out there. And we were walking out there and I didn't see it. It was off to my right. The tentacles were dragging behind. I felt something on my back, and when I spun, it just kind of wrapped around me. So I had the tentacles around my waist. I was able to clear it, but I got a really bad burn from that. It hurt. It hurt a lot. We don't need to see the video, but it's not a typical jellyfish. It's made up of multiple organisms working together. It was named after a Portuguese man-of-war ship. Got gas-filled bladder causing it to float on the surface. That's what the stinger or the jellyfish, as it wraps around you, will cause these linear strands. They can extend upwards of 30 feet. Painful sting, shock, and fever with big exposure. Usually it's local inflammatory, affecting legs, arms, the torso. You can tell that that looks pretty uncomfortable. So vinegar will negate the toxin. There is something called Sting No More spray. They keep this in beaches where they're up in the first aid station that they can spray on it. It's basically a vinegar-based product. It's controversial whether you should use seawater or fresh water on these. Generally, you should not use fresh water. Seawater can spread the stinging capsules, but sometimes if you have to irrigate and all you have is seawater, sometimes you can use that. Ideally, you would prefer to use warm water, 45 minutes of about 115 degrees. Ice packs make it worse. If somebody has the barbs still in them from any of these kind of things, you want to remove the barb. Similar, I didn't mention this with bee stings, but if there's a stinger in, you don't necessarily want to squeeze that to pull it out, because you might theoretically inject some more of the venom in. You want to kind of flick it out with the corner of like a credit card or a little card, or even a knife without cutting. You want to kind of flick it out. This is that stuff, Sting No More, that I was saying. You can actually buy this on Amazon, or you can buy it on the internet. You can also, if you go to beaches where jellyfish are common, at the first aid station, they have hot packs that you can put on these. Probably would be good to have something if you were on a charter fishing boat, or a snorkel boat, and you were out in the water, to have those heat packs with you. So does peeing on it really help? I'm not sure. I've heard that for quite a bit there. I've probably done it also, but it doesn't particularly alleviate the pain. Remember, vinegar, right? Vinegar is going to detoxify that. So the concept is maybe the urine will have a similar effect. It doesn't really work well because of other things that are in the urine. So it actually may release more venom. Try removing the stingers, as we talked about, flicking them out. Douse your skin with vinegar or that commercial stuff. Hot water to the affected area. Most people don't travel around with a half a gallon of vinegar with them, so hot water is probably going to be your best bet. Now we get into the really, really toxic one. We had the pleasure, one of my daughters was studying abroad in Sydney, and we went down there to visit her, and we went scuba diving up off the Great Barrier Reef, and that's where these babies live, the Australian box jellyfish. I was coming up under the dive boat, and one of my sons was below me, and I wasn't really paying a lot of attention. I was concentrating more on where the boat was so that I didn't hit my head. And then I got back up on the boat, taking off my gear. He gets on the boat. He says, "Did you see the jellyfish right behind you?" And it was one of these box jellyfish. So I didn't see it. I'm glad I didn't see it. I probably would have panicked. Also, and I didn't mention this before, but if you're doing any kind of underwater snorkeling or scuba diving, whatever, even if the water's warm, you should probably be wearing some kind of skinny or protective wetsuit, not necessarily for thermal control, but to protect your skin from an accidental exposure to a jellyfish. The box jellyfish, very, very toxic. Some of the most dangerous animals in the ocean live northern Australia, Southeast Asia. Again, long tentacles, so you don't even have to be right next to the jellyfish because the tentacles are going to extend out a number of meters away from there. When the tentacle hits you, it has little barbs on it, and they shoot out and inject into your skin, and venom is injected. They're very, very painful. Probably in the last century, multiple people have died from box jellyfish. So best thing is you would need to be aware of that and stay away from these if you see them. Typical symptoms of exposure, like the other envenomations, you're going to get skin reactions, severe abdominal pain, chest pain, shock. If somebody gets stung by a box jellyfish and they go into cardiac arrest, continue CPR because there is a There is a antidote for this. Call 911, get them to help right away. Hot water, vinegar, avoid fresh water, start CPR. There is a jellyfish, a box jellyfish antivenom. So in Australia, this would be available in that clinical setting. What not to do, again, don't go near them. If you see them, don't pee on them. Don't put alcohol on them. Don't ignore it. Now this one, very, very tiny, very tiny. You can see them in this little jar, tiny, tiny. It's going to be hard to, but they tend to swim in schools, or they're in schools, so you might see a bunch of these in the distance. Stay away from them. Small, but very, very deadly. You can see the size of this. Painful. Same reaction as the other ones we talked about. Stabilize the patient, first aid. Local venom effects, including on the skin, but also systemic effects. If you can get help right away and you can reduce the exposure, they can do well. If you fail to get help, they can get significantly ill. Last one is the cone snail. The cone snails are pretty much all over the world. Not all of them are toxic, relatively small, highly venomous snails. Again, you might step on these or get exposed that way, or you go to pick one up. Shells that are roughly conical. They have a significant proboscis there, and that's how they hit their prey and paralyze their prey. Very, very potent venom. A lot of cone snails, but not all of them are toxic. You can see pretty much found throughout the world. They bury in the sand, so you could theoretically step on these. Sharp pain. This is the one I was telling you that they're actually looking to see if this might be it might be something that could use therapeutically also. Because of the toxicity, this also theoretically could be concentrated, used as a mechanism of bioterrorism. Warm water again. This is endotracheal intubation. I don't know if you guys have done this in the sim lab yet, but you really want to protect the airway. I really don't exactly understand how these work, but they may actually be used as medicinal therapies. You could theoretically create bioterrorism agents with concentrated stuff from the cone snail, toxins from the cone snail. Okay, what's the take-home message? Eat more chicken. I don't want you guys to be afraid of swimming in the ocean. I don't want you to worry about eating fish. Just be knowledgeable about what's out there. Keep your distance. I guess a couple of take-home messages. If you're stung, hot water is better than cold water. Remove the barbs, not by squeezing them. Flick them off. Be aware that stonefish, lionfish, have those spines on the back, so give them their distance. Color is bad, so things that are very brightly colored, that's their way of saying stay away from me. But please enjoy the beautiful creatures out in the sea. Just give them their distance and enjoy that. Okay, thank you very much. I won't see you before your test tomorrow, so good luck for those of you that are having exams on Friday. I'm sure you'll all do well. Tomorrow we'll wrap up with a little more hands-on kind of stuff. So we'll demonstrate some techniques for reduction of common dislocations and fractures. And I think we're going to try and have a little chair or table up here where we can do some stuff with that. Okay, thanks, and good luck tomorrow, you guys.